Clinicians, today I want to talk to you a little bit about the Extern brace and some of the other braces that have led up to the Extern development, treatment for foot drop and drop foot pathologies, from stroke, multiple sclerosis, cerebral palsy, post-surgical trauma, and Charcot-Marie tooth disease. Traditionally, a posterior leaf spring like this, which provides some flexibility in the upper shaft with a cuff that goes around the calf muscle, goes inside the shoe. Patients put the shoe on with the brace already in it. Then you've got a solid AFO like this, which has a little bit more control in the coronal plane. And then something like this, like a balance brace, or this is a shortened posterior leaf spring type style. This is wrapped in leather. It's a little bit more comfortable, sometimes a little bit more flexible in the arch. Then about 20 years ago, we had the invention of the tamarack joint. The tamarack joint right here is on a hybrid, basically posterior or solid leaf spring with the tamarack joint that lifts up the foot like this, pushes up on the foot when you've got foot drop. And there's several different ways to configure the tamarack joint. Here's an active brace that's got independent struts, a few Velcro straps, a rear foot post. All these types of things typically will go into the shoe at one level of ease one way or another, undo the straps, slip it right into the shoe there for your patient. And then more recently, you start to see some of these carbon fiber AFOs, which are absolutely fantastic, and this is incredibly popular. About 25% of patients that have foot drop are going to require plantar flexion as well as the dorsal flexion. This is really a fantastic way to get someone who doesn't have use of their calf muscle, their posterior group of muscles right here, to toe off and really get that foot plantar flexing and bending down to propel them into their next phase of gait. This is a posterior cuff, which is really great for those people who are just suffering from foot drop with the anteriors not working. And this one right here is got the anterior piece right here, so they can really lean into this with their shin and get some propulsion off of the foot plate. So these are our dorsiflex braces, really, really nice. Now let's talk about the Extern, which is what this video is going to be about today. The Extern is absolutely fantastic. The cool thing about this, let's just back up to these dorsiflexors here. For that 25% population that needs the plantar flexion, this goes into the shoe. The patient can get this on really easily. This is a fantastic option. These are all fantastic options, but this is so new. The history of this was created by a gentleman who was an engineer. He was a tugboat engineer of all things, and really active, loved to run marathons, loved to hike, and unfortunately was in a snowmobiling accident, broke both of his knees, and resulted with a unilateral foot drop. This is after the surgery. They severed the nerve, and he couldn't lift his foot up at all. It was completely flaccid, and he just wanted to get back into snowshoeing and running marathons and things like this. And after trying a variety of these braces, this was back in 2001 when he had the accident, none of them really cut the mustard. He couldn't get anything to work with his boots. None of these really work well with boots, as you can kind of tell. All these go into the shoe, and he worked really, really hard to kind of sort out some invention for himself. Himself being an engineer, he was able to determine, if you go all the way back, I think of Forrest Gump and the boots that he wore, they were metallic uprights, and some patients still have those today that attach to the outside of the shoe. And that was really necessary for someone who's wearing a boot type of shoe gear. So he started the drawing board and came up with this. So this is kind of a modern, like, hey, why don't we think of this sooner design, which is really fantastic. Nothing goes in the shoe, so nothing is irritating the arch, the metatarsal heads, the ball of the foot, the toes. Nothing is irritating the malleoli. Nothing can rub along the side of the leg. Everything is on the outside of the shoe. And it's really, really cool. Check this out. I'm gonna clear these things off really quickly here. Give us a little more space to work with. And let's take a look at this right here. So this is an athletic shoe. It's got the clip that's installed right over the distal laces like this. First thing you want to do is line this up, put the clip in like this, and you notice, wow, in 2 seconds, you've got this thing that is ready to go. And you can have this on several different types of shoe. We'll get into that in a little bit. And you can put this to a variety of shoes, have all of your shoes equipped with these clips. These are installed with little zip ties. We'll get into that as well. And then what actually makes this work so well is the function of looping around the heel like this. And then the pivot point is this little lip right here. It's on both sides, as you can see, pulling up onto the front part, the vamp of the shoe. So you can really get this guy to get a lot of action to dorsey assist your patient. And we'll get into it a little bit further, but first let's talk a little bit about what it's made of. This is an ABS plastic, so it's plastic injected. It's incredibly durable. One of my friends in the industry, he makes the JAFO, which is a really cool brace. He said to me the other week, he said, yeah, you know, the problem with these, the JAFO, I invented it for the braking that we always had with the posterior leaf springs, and this thing just never breaks. It is so durable. The only thing that really can cause this to break is if you actually step on it sideways. So if your patient gets out of bed and steps on it like this, you might cause it to crack at the joint right here. Otherwise, these things are really durable. We've got a cuff up here which is adjustable. It comes in a few different sizes. I'll also get into that. But yeah, let's go right into the situation where you've got a patient. It's a new patient. They have foot drop, and what that basically looks like. So I'm going to put this on myself. I'm going to use one of my shoes. I'm going to presume that I have foot drop, and we're going to kind of go through the motion here. So basically, the Extern, you want to get this trial kit. This is a demo kit that has all 3 sizes. This is an order form. Get rid of this bag. We've got our zip ties and our little tool that we need to adjust it. And you've got small, indicated by this blue marker right here. A medium, indicated by this green marker right here. And a large, okay? Now don't get confused. It says ATX large. When I first saw this, I thought the ATX meant extra large. And these are the sizes that it fits, size 11 to 16. It actually goes bigger than 16, all the way up to about an 18 or 19 shoe. But we'll also get into that in a little bit. And so these are trial braces. And so I want you to take a really close look at the difference between the regular brace. This is the one that your patient's going to want to wear. See how it's very slim? It doesn't have any extra pieces. Take a look at the trial brace here. Let me compare this really quickly. I'm going to put the trial brace on. You can see it's got an extra piece here with a little bit of a screw. This screw allows you to take this hoop and slide it distal or slide it proximal, and you can sort out, depending on the shoe that your patient likes to wear, exactly, okay, we know they're going to be a small, they're not a medium, they're not a large, and because they're a small, we then just have to dial in the millimeter length that's on the bottom. This hoop right here will extend or retract back into these little holes, and that's what we want to do. So let's fit myself. I'm just going to make it really easy. I'm going to go to this order form right here. On the order form, we have a sizing chart, and on the sizing chart, I've got a men's shoe size, and let me pull out the shoe that I had set aside for myself to show you what I'm going to do here. I took my running shoe, and I'm going to take a look at the inside of the shoe. Okay, and this is a men's 10, okay? So, men's 10 right there. Let's go to the men's shoe size. I'm at a 10. That means I'm immediately going to be in a medium, and I'm going to be at a 19. Let me show you how that works. I'm going to pull out this little Allen wrench right here. I'm going to take my medium. Let me clear off the table here, make a little bit more space. And on the bottom here, you can see that I'm set up 15, 16, 17, 18, 19. And well, let me tell you, I was not planning on this, but this is already set at a 19. It's just about a millimeter shy, not bad. And let me just make sure that it's tight. These screws are tightened down, so that's good. I'm going to test this out really quickly and just see. So what I want to do is first see if the heel, and you want a cone situation here. Some of the dress shoes or Vans or in a Converse or some of these shoes that are very vertical, it doesn't work so well with them unless you modify and put a little lip on the shoe, but about 90% of the shoes people like to wear, this works amazing. So this hoop is really important. This plastic piece will stretch and bend. You can also heat this up to make it a little bit tighter or a little bit bigger if needed. And I'm gonna stick that on right like this. That fits pretty well. And you know what? Remarkably, this lines up right with these two lace holes right like this. So as remarkable as it is, I am just gonna leave it right like that. And let me show you how I set this up. Okay, I can see that the laces, I'm having a little bit of a hard time accessing this. So let me just pull this out really quickly. Just make it a little bit easier for me to get my hands. There we go. My tongue piece was hooked up on the laces. So now I can get my fingers underneath here I'm really quickly just gonna put this in. You're a busy physical therapist, orthotist, podiatrist, orthopedic surgeon, whatever it may be. You can quickly put those zip ties in. I'm gonna then slide this right over like that, right onto the heel. I'm gonna take the zip ties and I'm gonna tighten them right around these front hoop, right around the front hoop. And now look, take a look at these ribs right here. I wanna be in the furthest outside I possibly can and cinch it down real tight on this trial, or the demo. I'm calling this a trial brace because this is something that the patient's gonna put right on. And see how this works? So see how I'm tightening it right to the outside pieces right here. This is gonna ensure or simulate that when I, see how this switches up like this? When this pulls up, I do not want this to come tight. I want this to stay far out as I possibly can. So I'm gonna push this all the way out to the final rib like this. I'm gonna tighten it down. Perfect, just like that. And then I like to keep a little bit of like a nail clipper or scissors, something like that, just to snip off these extra things. Looks a little bit neater for your patient like that. That's gonna hold it. Now on the clip, it's a quick install. It takes 2 seconds, as you saw earlier. Just pop it into here. You can see how it's zip tied. And there's different configurations to zip these into different types of shoes, and we can get into that too. So now that I've got this going, let me lace this up back to where I had it. I'm not gonna use the interlace thing this time. Not a big deal. Okay, perfect. I'm just gonna move this aside and I'm gonna grab a chair. Okay, so now I'm gonna take this shoe off. We're gonna try and fit it to this shoe later. So we're gonna hang on to that shoe and we'll undo this Velcro piece like this. I'm loosen up my laces like this. Pull the tongue forward, and I'm just gonna step right in. Now what your patient's gonna wanna do is sort out the best way to do this. So I find it's always best to kick the heel out right like this, stick the foot in just like this, get the shoe kind of gathered. They can just kind of reach their finger around, pop right in, use a shoehorn if they need to, and then cock the cuff, right like that. And you already are gonna have some tension lifting up on the foot like this. So the tension lifting up on the foot, sometimes the heel's gonna wanna slip out of the shoe a little bit like this. So it's really important when you're wearing this brace that you snug the laces. Don't forget to snug the laces. Sometimes the foot drop patient's really excited and they wanna get up and go. Make sure you just snug the laces, not too tight, just so it's snug right here as they normally would. Like that, perfect. I'm gonna leave this on the outside of my pant leg. Clearly this will work going with my pant leg going over the cuff. This here, this strap, this piece goes right on the anterior shin, right like this, and right over like this. Now I'm just gonna kind of see where I want this, and that looks pretty good. See, let's say I wanted to cover this up a little bit more. I wanna show you real quick how to adjust the strap in its entirety, okay? I'm gonna pull this off. You notice these are really high quality Velcro in these straps, but take a look at this. This whole strap is independent like this, and you can adjust it just by feeding it through here, and you can give it some, pull it in, or you can give it some slack, or you can give it more tension wherever you need to put it. So I'm just gonna kind of, suppose I put it right there, I'm gonna eyeball it. Yeah, right about there, that's fine. I can loosen it up. Let me loosen it up about an inch, maybe a little more, something like that. Okay, great, now it's going a little bit further over. I like that. Set that in. I'm gonna put this right over. Great, that's attached. I'm then just gonna feed this over here, like this. Looks like the shin strap's a little bit more medial. I'm gonna readjust that. There we go. Now it's centered, get that set up. Put this like this, and put this guy on right like that. And as you can see, I'm just gonna stand up like here, you can see it's already holding my foot. I have actually, with my plantar flexors, my gastroc, my soleus, I can really plantar flex the foot quite well. You can actually drive with this. It's almost got like the most perfect tension. And one of the questions we get asked a lot is, can you adjust the tension? And I will tell you that with the only thing that you can do is adjust the length of this hook right here. You can take it further distal, and that will be less tension on the spring, or you can adjust it to be more proximal. So you can attach it to more proximal eyelets that are on the laces right here, and that's gonna actually give it more tension. That's the only adjustment, and it's dialed in. Out of 6 years of research and development, failures and successes, this is really a great design. And again, this is the trial with this guy right here, but the actual real brace doesn't have these screws, and it's permanently set. And I'll show you what that's all about. So as I'm walking, it's incredibly comfortable. As I come down for heel strike, you can see it allows really nice natural heel strike. It delays that foot slap, which you have if you don't have the assist of the Extern or any of the drop foot braces. And the other thing that's really great is you can take a look and see how much I can move. Take a look at me from the back here like this. It's really, really nice. You can have natural pronation and supination. You can put an orthotic inside of the shoe. So if you have an orthotic therapy requiring offloading of certain metatarsal heads, ulcers, all sorts of different things, this will take care of it. There's an ankle stabilization strap. We'll also get into that. But it's extremely comfortable. It is so much more comfortable than any of these other drop foot braces that we've had. I'm absolutely thrilled with the way that this works. Let me show you how I take it off, and then we're gonna fit it to this other shoe. So, pop this guy off right like this, and untie my laces. Voila, off it comes. Now, let's jump back up here. I'm gonna roll this table over. Okay, so this thing's not flopping around and it doesn't get caught on your patient's pants or anything. I always like to close that Velcro back up. Let's put this and try it on the other shoe. Take my clippers or my scissors, pop that off. Now, this was remarkably set at the recommended 19mm length. Let's just see if it's gonna work with this shoe. I put this on. Yeah, you see, this is a little bit too far distal. Let's compare these two shoes. Now, with these two shoes, let me pull these zip ties out. You can see these are similar, but they're just a little bit different, okay? This is a Saucony 10. This is a shoe by Superfeet. Believe it or not, this is a men's 11.5. It runs a little bit smaller than the Saucony, which is why this is my personal shoe. Both of these are my personal shoes. And if I am gonna get the Extern, I wanna have an Extern set at the right length to work for both of these shoes. So if I were to put this clip right in here, I would think that this clip is just gonna be, okay, actually I'm looking back at the hoop. Look at the amount of space I have back here, but this is kind of like the place that I want it to be. So let me just kind of compare these two. If you've got two different types of shoes, you may want to have your patient come in with a couple different types of shoes. Whenever I have a patient come to see me, I always ask them to bring 2 or 3 examples of shoes that they're gonna wear. And if I were to put this here, okay, it's pretty tight and close in, all right? So perhaps with this particular shoe, because the laces are more distal on the Asics than it is on the Superfeet, I am gonna make a compromise, and I'm gonna take the Asics and I'm gonna bump it up and just set my Extern to be about 4mm back like this, okay? So it's just a little bit back like this. So if I take this now from, it's at a 19, I'm gonna bump it down to a 15. Watch me do that really quickly. You haven't seen me adjust this yet. Watch how quickly this works. So I put this guy in, this Allen wrench. Loosen that up. I'm gonna then loosen this one up. All right. From there, let me see if I can adjust it. And I can, it's a little tight, but that works. I just bumped it up to 22. Watch me push this down. I'm gonna go to about 15, I said, right? I actually think now that I'm thinking about it, I'm just gonna go to about a 12. Okay? Quickly go to about, that's a little too tight. Bingo, right at a 12, right like this, okay? Let's see where, if I just push this forward. Okay, I like how that's gripping the heel, that's good. And then Yep, it's gonna just sit a little bit more proximal than it was initially. I'm gonna lace this through these two eyelets here and here, okay? So I'm gonna put the clip here and here. Let's take a look at this guy here. And on this shoe, I'm gonna put the clip just distally right here. Take a look at where the hook is on the back. This is fine. If it hangs out too far like this, I'm concerned as I come down the stairs, I may hit it on a stair or something like that. You don't want it to sit out too far. I think the most you'd ever really want it to sit is about a centimeter or about a finger's width out. Either about a finger's width out, or my finger, okay, depending on how big your finger is, or 1 centimeter. Or you can have it all the way tight like this. Either way is okay. If it's really, really tight, it's okay. You put the clip on. Let me do it with this guy right here. This one's the finished product. I'm gonna put the clip on like this, and you're just gonna be able to fit it, and regardless of how tight it might be, you can get it to sit right around the heel counter of the shoe. You never really want this thing to be too tight on the heel counter. You want it to just kind of be sitting up almost on the very, very bottom, okay? And that brings me to the next point here. I wanna show you this really, really quickly. Take a look at this here on the order form and on the size chart. You notice that when you get to a men's shoe size 3 or 3.5, or a woman's 4 or 4.5, you become in between the petty size, which is the pediatric. Let me show you that really quickly. The pediatric, check this out. It comes in pediatric. I'll show you a little bit more about this in a minute. But you're kind of looking right down here, and it says shoe size from patient foot width. What that means, patient foot width, is essentially the heel cup width, okay? So if they've got a wider heel or wider shoes, you're going to want to err towards the larger of the two sizes. So if you're a 3.5 men's or 4.5 women's, you want to go up to a small and not go with the pediatric Extern. And then let's take a look at the 8 and 7.5, or 9 and 8.5. You're at a medium and a small right here. And if they've got a really narrow foot and they like really narrow shoes, you can err towards the small Extern. And you're gonna set it at one of these lengths right here, the hoop lengths in the small at a 7 or a 3, more or less. You'll trial it out, do it really quickly, see what works well for your patient. And then if they've got the wider heel, go up to the medium, and you'll dial them in like this. So small 43 or 40, or medium 7 and a 3. I'm reading upside down here, got that a little transposed. But okay, so we talked a little bit about the width, and then choosing, versus the size of the heel. That's pretty important. But that's why you get the trial kit. You get the trial kit so you can put it on your patient and really see what's going to work best for them with the size. Usually really takes 5 minutes when they're in, and maybe you have to put it on about 4 or 5 times. Put it on your wife, your husband, your kids, your assistants, and just kind of play with a couple different ways. You'll have fuddle with zip ties to get the clip situation. Let me show you how we get the clip on really quickly here. Let me grab a clip real quick. This particular shoe has the clip installed already. I'm going to take this off real quick. Now, I wanted to take this clip off and show you something really important. It's really important that you know that there are 2 different size clips. There's actually 3. The clips that we have, here's the pediatric one. Take a look at this pediatric. Now, with the Extern, notice that the pediatric is in a blue color right here, and the older versions of the Extern is called the FS3000, and they were all blue. Well, they got rid of the blue color, and now we've got this black color right here, and it's a little more discreet on the shoe. The pediatric is still in blue right now. So just so you're aware, if you see any of the blue ones floating around, or patients come in with these blue ones, because this has become so popular, you'll know that the new one right here, the Extern, this is like the FS3000, but for the pediatric, it's still called the Extern. But take a look at this clip right here. This clip is the pediatric size clip. I'm gonna pull this off so you can see it. Okay. Now, all the parts have a part number. And right here, L00P, right there. Okay, that's for a pediatric. This one here is the medium. Let me find the small. Okay, here we go. So we have pediatric, small, and then medium and large. And this one right here, it's turned upside down. You've got FS3000, L00, S, that's for small. And then this one here is FS3000L00, that's ML for medium and large. Also, if you may notice, the pediatric has 2 holes, and the medium, let me spin these all around so you can see them. The pediatric has 2 sets of holes on either side. The small has 3 sets of holes, and this one has got 2 sets of holes. Well, the reality is these originally did have 3 sets on these clips. However, they have been cut off to be fit to different types of shoes, so you can do that. It's another adjustment and fitting option. You see there's little hash lines that are right here. Okay, see that little hash line here and here? That's a position, you know, you can grind it to that level, or take a big utility scissors, cut it off, polish it off with a grinder, and things like that. But real quick, I'll show you that this fits really well in the pediatric. And if you try and take the pediatric hoop, the front hoop like this, and fit it into a small, it's actually gonna be incredibly large. And it's gonna be, well, that one fits a little bit better than I thought, but that's actually not too bad. But the problem, I think, with the small one is that it's not gonna fit on the shoes so well. Putting this on this shoe, that's pretty bulky. You don't wanna go to that smaller size. That'll fit so much better on a kid's shoe. This is where you'll notice the difference. The pediatric, it's really, really too big, okay? I can't even seem to get this on. You can see it's kind of sloshing around in there, and it's not purchasing itself really well. We notice that too with the large. Here's the small Extern. If I take the large clip, it just kind of sloshes around. It doesn't fit so well, okay? So that's why you wanna make sure you're using the small with the small, and the medium and the large with the medium and the large, like this, okay? So they've really thought of everything to get this dialed in for your patient, and it's actually quite simple once you kind of see a few of these things and the tricks. So let's go back to fitting this. So we took this, I'm gonna move these off to the side, let those sit over here for a bit. Let's get the pediatric shoe out of here, remove this guy. And I wanted to show you how we install. Let's install it onto this shoe. I've yet to install it on this shoe. See how this is in here? Let's undo these shoelaces like this. It'll just make it a heck of a lot easier for my fingers to get, there we go. Now I can get up inside of this right here like this. So I'm gonna take this is now at a 12. I wanna verify the hoop. I did this already, but then we got into doing some of these other things. Yep, okay, I see where I wanna put this, right about there. I'm looking at the hoop length seems to be okay. Right about like this. That's actually really nice. If you look closely, see how this is sitting over the rib of the sole? This is the ideal position, okay? This is a little bit stretched and wide like this. You can see it's popping over like this, but this is really nice. And because this gets wider and wider, it's not gonna pop off. That's the beauty of this. Let me take a look at this other shoe. Okay, let's do the same size, same side, left side. So we've got a fatter shoe here. This is a Saucony shoe. If I can get this to stretch over the sole, it would be a better fit. It wouldn't run the chance, and I've made this mistake. I fit a patient, and they ended up getting a little too tight on the heel. I had to heat this up, or actually, you don't even have to heat it up. You can stretch it. Let's see if I can do this. I'm gonna do this for the first time and see. So yeah, I'm just kind of pulling this over and setting that down. That looks pretty good. There's a little bit of a ridge right here. I'm gonna see if I can find its home and kind of pop it all the way down there. Bingo. That is great. It's stretched over the heel. That's totally fine like this. And that is a much better position. Once you're in the clip like this and you're wearing this, that's the way to go. That's the way to set this up for this shoe. Really, really nice. And purchased in between these two little pieces here like that. This way you're sure it's not gonna irritate the calcaneus. Okay, it's not gonna be pinching the counter. If it is up on there, it's actually okay. It doesn't seem to bother it. But it depends on the anatomy of the patient and the shoe they're wearing. All right, let's go back to fitting this Superfeet shoe. So, I know that the size is okay. I didn't tighten these down, did I? No, I didn't. It's a little bit loose, so I'm just gonna make sure that you tighten them down. If you don't tighten them down, I've had a patient put this on, and this flew out of the front section, and the front section hoop, the front hoop here just flew out of the brace. No big deal, it's kind of comical, but not a big deal if that happens. Just gonna screw these guys down like this. Perfect. Now, let's do this. I'm gonna verify I've got the medium large piece. Great. And I'm just gonna put this here one more time. Yep, good and good, I love it. Okay, so that's perfect right like this. So let me just kind of explore this and see where I wanna attach these guys. Do I wanna put it here? Do I wanna put it like here? I've already cut this one down. There used to be 2 sets of holes on either side. There's only 2 sets left. So let's grab 2 more zip ties. And let's do this. I'm just gonna kind of eyeball it and see. It looks like I wanna go and use the outer holes. We're kind of in between the inner holes and the outer holes. I'm gonna use the outer holes. Rather it be too loose here than pinch your patient's foot, okay? So I'd rather stretch this out to be just a smidge wider by a millimeter. So I'm gonna take this, feed it right through here. Really easy, just like this. Zip tie that. Now, this might get away of this hook coming in contact right here. I mean, it does clear it, but just to get it to be a little bit neater, I usually like to shimmy this back all the way there like that. See that? It's a much neater installation. And then zip that down like this. Really nice. Let's take a look at this one. A little trick is, with some of the harder shoes, this is pretty easy it seems right now, I like to leave it loose so I can play with it and get my fingers underneath, and then I zip tie it. This worked pretty easily and pretty slick, so I'm not so worried about it. Push this guy in. Pull that. Great. Like this. I'm gonna go all the way over like that. Now I've pulled this too hard and I've broken the zip tie. We give you a lot of extra zip ties, and if you need any more, we've got them at your disposal. You can also run down to the hardware store and get these things, no problem, if you need them same day. Just gonna clip that off like this, and that's pretty good. So that, just verify that that works so well. It looks like I'm tilting off to one side like that. Let's make sure and explain to your patient that we want this to go boop, all the way down right like this. That is a really nice purchase. It's totally vertical, straight, looks great. Let's pull this table off to the side. I'm standing around here in one shoe. I'm just gonna put this right on myself so you can see how easy that was. I'm ready to go. Okay. Easy. Cock this around. Get this going. Oh, it looks like I forgot to lace up these guys, no problem. Will this be in the way? Will I clear it? I cleared it. Great. Do this for your patient before they put it on. All right, great. And this is a beautiful fit. This really works quite well. Let me show you what it looks like, how easy it is to slip it over a pant leg and pull this up. This is so comfortable, and by the way, let me show you this. This is removable, washable. You can remove the strap. These are super replaceable. We have plenty of these to ship you on demand if you need them. These things can last from 6 months to a year, depending on how aggressive your patient is with getting them dirty. I'm gonna put that right like this. Now, there's one other thing I wanna show you. On the back here, you want to avoid with the cuff getting up into the popliteal like this. You want to keep it just a little bit below the popliteal. So what are you talking about? This is the first time I'm even showing you this. I'm just going to show you real quickly here. I'm going to take this off. Okay. I'm going to take this off and just show you right here like this. Let's pull this table right back around and I'll show you what I mean. Okay, so really, really easy, super durable. I squeeze these pieces right here like this and pop it off like this. And you've got a little button that's on a little spring action like this, okay? And that little button is gonna stop it from going down. So my little trick of the trade here is I take my finger and I put it underneath like this, and I push this button down, and then I hold it so I can clear it like this. Why do I want to do that? Because guess what? I can slide it all the way down. And I've got a variety of holes right here that I put this on. Now, when we put this together and you give me the patient's shoe size, generally, there's a correlation to the tibial length and how big the calf is, so we're gonna get this right for your patient, but maybe 1 out of 100. It's gonna be too short. You let us know, we are immediately gonna give you a new upper where it's gonna be the right size. But as you notice, this one was a little bit too short for me on the trial. I'm on 4, 3, 2, 1. So for this medium, it shares the actual same size with the large. It actually has 1, 2, 3, 4, okay? 4 of these holes. And you can see there's 5 of these holes actually, and there's 3 that are left. So it was a little bit distal. And I had a patient actually yesterday who came in. She'd been wearing these for about a year, and I didn't fit her. She got them directly from the company before we started carrying them in the United States. And I ended up sliding her, rather than being set like this, I slid this up by 1 notch, and she felt so much more comfortable. Even though she loved these, this is better than anything else she had. But this is what I'm gonna do for myself. You saw me put it on, and I'm gonna boop right here like this. And that's a big difference like that, okay? So it's gonna be about almost an inch taller. And now you can see how this lines up on my leg here a little bit better. All right, pull this aside. Get this going. Right, like this. That's really nice. Okay, you can see up here, it's about almost an inch taller than where it was. And I'm gonna have much more comfort with this putting pressure, dispersing it among my calf muscle, okay? This fits really well. Not too tight, not too loose. Comfortable like this. Can I get this over? I don't think I can. These Italian pants, no, these are Brooks Brothers. Well, I'm gonna struggle to get this over, guys. This is reality TV for you, okay? Should have tried with these pants before we started shooting. Well, but it's gone, it's gone. There's a product called the JAFO. I'm gonna show it to you. There we go. That works quite well like this. And it's kind of hidden. I'm gonna actually just show you the JAFO really quickly. I'm gonna take a look at this here. Let me go pull this JAFO, it's right in the other room. My buddy James D invented this thing. This comes in custom sizes, and we'll get into this in another video, and I'll show you more about this. But I want to show you how this works so well for that issue that you saw that I'm having a hard time pulling over these pants. If you're wearing skinny jeans, obviously this is going to have to go over that. This worked for my pants. Let me show you how quickly it is to put this JAFO on, which is a really cool product. I'm gonna pop that off. Let's actually pull the table back. It'll be a little bit easier for you to see it. Okay. Again, I'm gonna close this because this Velcro lives to stick to everything. It's really high quality Velcro. All right, so the JAFO. This is the JAFO right here. JAFO. Pull this guy off. I'm gonna pull this guy off completely. These, don't throw them away, keep them because you might wanna use them. But frankly, everyone who tries this JAFO doesn't wanna get away from it. And then I slide this underneath just like this, okay? I Velcro it in place. Now it requires a little bit of adjustment and figuring out where to go, but let me show you how this all sorts out. So I'm just gonna attach it, it Velcros on the inside, right like this. You've got this one piece that pops in, like this, okay? Let me see if I can get an angle for you here. Just gonna put it on right like, I'm just gonna set it on the first one. It's right there, the button's in there and it's set. So that's good. I don't have any of the Velcro straps on. This JAFO takes care of all of that, all right? This is an awesome product. Okay, so the Velcro, there's 4 Velcro dots. 1, 2, 3, 4. 1, 2, 3, 4, like this. I'm just gonna kind of eyeball this. I'm lining this up, the seam, with this guy right here. I'm just gonna invert that guy, boop, right like that. Beautiful. All right. Let's go ahead and put this up. Beautiful. It's already more comfortable, actually. It just distributes pressure. And this is a neoprene. It breathes somewhat. It's really comfortable in the summer. This was invented, you know, I mentioned this to you earlier. This was invented for posterior leaf springs. Hang on one sec, let me show you this. This was invented for this type of brace. Okay, so you may have seen this little piece right here. With this, you actually completely cut off this piece here, and this piece goes all the way through here because this used to fit so much tighter on the leg. And now with the Extern, you want this piece here. It moves away from the leg to give you more leverage to lift up and for more comfort. But check this out. Works out really well to close this. It's like zipping a jacket. Okay. Now this is, you know, remarkably, I didn't even check my size, but this looks like it fits me pretty well. It's pretty snug. It's really comfortable. You got this little Velcro piece right here like that. Just pull that down. Let's see how easy my pant slips over this. Yeah, it's a lot easier. It's still a little tight. These are the Brooks Brother Milano pants. But yeah, that slid over a heck of a lot easier. Okay, so that's really, really nice. This is super comfortable. And so this is great. I'm ready to go. My patient's super happy. I've seen parents cry. I've seen patients cry when they wear this thing. It works so remarkably well. As soon as I saw this, I told Francois, who's the inventor and the engineer, and Stefan, the owner. These guys are partners. They're in Quebec. It's a French-Canadian company. How well that this thing worked. And after dealing with these braces and fitting them for 14 years, I said, this is incredible. You've really got to get this into the United States. And we were fortunate enough to get an exclusive distributorship in the United States just this past fall in 2018. Let me show you what I'm going to do on the front part of the order form right here. Just grab my pen. So you want to fill in your clinician information right here, your patient information right here. Patient email, we usually want to get the patient email because we have a system that will check in with them with your permission that, hey, it's been a year, how you doing? So that's what we want that for. And date of birth, sex, this is for the shoe size, okay? This is important. And if you take a look at step 1, all you have to do is indicate what size AFO you want. So we've discovered that I am a medium, and I put myself, I don't know what I put myself in. I was supposed to be at a 19, or I can't remember. Let me take it off really quickly. That's what I want this trial race. Let's see here. Bingo, I'm at a 12. So I'm gonna be in a medium. If they're bilateral, just write 2 right here, okay? 2, I'm writing upside down. That's not something I can do so easily. And then we're gonna put right here in a medium in a size 12. That's it. And you can fax this into us. We also have a portal online where you can order this online. Oh, ankle stabilization straps, an extension stopper kit. The extension stopper kit, let's do that in another video. The ankle stabilization strap, give me 1 second. I'm gonna run and get that. All right, back with this ankle stabilization strap. This strap is absolutely phenomenal for an overpronator or a supinator, someone that the Charcot-Marie-Tooth patient population, they've never had anything quite like this. We've typically done, let me show you this brace, so you know what I'm talking about. Take a look at this AFO. This is a Tamarack Dorsey Assist traditional AFO. It's solid. The anterior trim lines, or the tibial trim lines, are very anterior. It's got a plantar stop, okay? You guys are all familiar with this, so it stops plantar flexion and gives dorsiflexion assist. But then there's this valgus T-strap, so it actually, the foot that's in varus, you push on the lateral malleoli, and it brings the heel into a valgus position, taking that foot that looks like this, that's inverted, and straightening it out. Now, that's what this is. This strap is designed to do that with the Extern. This works so much better. I can't believe how much better this works. It works so much better because the frame is further away from the shoe, and you just have a little bit of distance gives you that much more leverage. So let me show you how this works. I'm gonna take the piece off. I started to take it off, but let's put this back on. I'm just gonna put it on myself so you can see what this is like. Great. Oh, forgot to put this guy through here. Put that through there. Great. I'm gonna pull the cuff out. Perfect. Great. Okay. So, this ankle stabilization strap, I'm going to undo this. There's two parts to it. This is the cushion part that goes on the outside or the inside, depending on what you're correcting. If you're completely inverted like this, rolling on the outside of your foot, the styloid or the base of the fifth is getting really irritated, all sorts of complications with this. This is just amazing to really push and straighten you. Now, you do want to check your patients to see if you can reduce their calcaneus to bring it back underneath their leg. And if they can, and if they're spastic and tight, then you know that you're going to have a great outcome with this. The other thing too with this brace, it's really easy to do forefoot modifications or any other equilibrium balancing with a foot orthotic inside the shoe. You can do that independently of the AFO, which is just a win-win situation, because you know how complicated some of these things can get. If you have to build it to the AFO, it becomes a lot of trouble to fit this into the shoes. So, I'm gonna slide this in. If you notice, I'm using two hands. Your stroke patients, they usually are gonna have the use of one hand. And I'll show you that in a little bit, getting this on and off with one hand. It can be done and works quite well. And the stroke patients that are used to having just an upright AFO or an anterior, tibial anterior piece where they can just slide into the shoe from the back, they figure out this works so much better. It's worth a little bit of an extra effort with one hand to dangle, cross the leg over and get it on with one hand. I'll show you how that works. Let's see, let me pull this up. I'm going to attach this, okay, like that. Great, so let's assume I'm in complete varus like this, and if I stand out, I'm walking like this. You know the patient population I'm talking about, and they have no ability by themselves to correct their foot like this. So what you want to do is you want to take this ankle stabilization strap, and you've got a little hook right here. And what you're going to do is you're going to put this on the back side right here. It's going to end up sitting right here, actually right on this guy. I'm going to come around. I'm going to swing it around like this. Now you have to make a mistake a couple of times to get this exactly right. Okay, I'm going to put this on like this. So this is attached. I'm going to feed this all the way around like this. Okay, remember the foot's like this. Okay, and I'm gonna put this pad right like this. Okay, so that's cushioned, and I want this to sit just above the malleolus, right? Just above the malleolus, right like this. And now I feed this strap underneath here, like this. Now this is the trial brace, so it's gonna be much smoother right here. You don't need to pull it back here, but I want it to actually wedge right in here. And as you can see, I'm in this position. Now just take a look at this. Oh, wait a minute, the Velcro's on the wrong side. No big deal. This is an alligator Velcro strap. So I undo this, and I flip it around right like this, and all of a sudden this is corrected, okay? Bingo, right like this. It's a little tight, okay? Or it's a little bit too loose, so guess what? No problem. I'm just gonna redo this really quickly, tighten it up. I'm gonna give myself another, there we go, like that. That's how quickly this thing, once you get used to it, that's how quickly you can do this. All right, so again, patience in varus. Push this guy around, right up underneath here like this. This is almost a little too close, I don't like it. I'm gonna adjust it to go a little bit further back, about an inch. See how I do with this. Bingo, now I've got space. I can take the varus foot and I can crank this. I can really, really push, and it's comfortable. It's amazingly comfortable. Look at how well that worked, okay? So now I try and roll out like this, I just can't do it. I've got this strap really, really helping out. We've got a great before and after of a patient showing how much they evert like this simply because the peroneals don't work. The CMT patients or all the other patients that are suffering from this type of pathology, they get such great results with this, and it really helps them. Now, we've had a lot of clinicians say, wow, this is gonna be great for equinus, this is gonna be great for pronation control, because check this out. This strap can just be flipped around. So I'm just gonna take it, put it over on this side, attach it, feed it. Now, if you have a patient that's in valgus, and my goodness, if you've got an irritated navicular, you've got callousing, at risk for ulcers, anything, you know, that posterior tibial tendon dysfunction patient with the stage 4, having this offloaded is incredible. So you can take this strap, pull it around to the top of the medial malleolus like this, and feed it through right like this. That alligator strap is on the wrong side, no big deal. Let's just get this flipped around. Like that, bingo. And look at this, I'm now putting my foot into a varus for someone who's in a valgus rear foot position, like this. And I have this, it's incredible. And I'm a pronator, I overpronate a little bit myself. And I wear orthotics, and I can just feel the pressure above my medial malleolus, and it's just pushing me back into a varus position, and it's super comfortable. It's dynamic and very, very comfortable to wear. So let's take a pause here, and we'll continue with some of the other videos. If you have any questions, email us, hello@kevinorthopedic.com, and we're happy to help you. Thanks.